As the director of quality, I look to ensure all of our departments, facility-wide, are operating at top quality for our patients and their safety. Every day's a little different. Check my email, get the ball rolling with checking in with my team, go and see the teammates out on the floor, round on patients, and then start tackling anything that may have came up, whether it be rapid responses, code blues, blood administration, anything that could come up, including incidents, trying to look into those and see if that is something that we can improve on within our hospital, and then start to develop and build out process improvements here. I had a hand in just about every department, every committee, and trying to drive them to be as operational and high quality as possible. I hired with Cornerstone in January of 2015. I did hire in as a CNA while I was in nursing school, and after a year became a nurse. I love it. I get to know my patients and watch them from start to finish, no matter what their healthcare journey may look like. And that's something that you just don't really get in other areas within healthcare. Legally, all hospitals have to be in contract with an organ procurement organization or an OPO per the CMS conditions of participation. Our OPO for Oklahoma is LifeShare. I'm a wonderful organization. They come in and they'll provide end services to our team twice a year or more if needed. Last year, we were deemed a platinum hospital for our organ and tissue education and involvement. The year before, we had reached gold, and I made it a goal that by year 3, we would be a platinum hospital. It doesn't seem like it's that big of a deal, but we're a really small hospital, and we outperformed and met the metrics to meet platinum compared to very large organizations. I'm really proud of my team and the work that they've done. My job is to look at that patient aspect, and that if somebody wants to be an organ donor, then we want to honor those wishes. We want to make sure we're following the processes in place so that we could get people to convert if they meet the qualifications and save more lives through that challenging situation that their family is going through. We had our very first organ donation here in this hospital, our partner hospital. It was also their very first. We collaborated and had a huge honor walk to honor that patient, love on their family, who I'm still close with. Even throughout their struggles and their grief, they were able to know that she lived on and she helped save multiple other individuals. And it streamlined us to be forced to start the processes, have the equipment and the communication and collaboration to do this for other individuals. Cornerstone is a long-term acute care hospital, so we typically see patients that meet ICU criteria but aren't able to stay in those short-term facilities for that few day to a week turn period. We allow them to have that high acute care for on average 25 days. That could be from a motor vehicle accident and trauma with traumatic brain injury to the geriatric population that's fighting with Parkinson's, dementia, etc. Everyone's journey looks different. You truly have to get to know your patient and know what they want. Do they want to get home, and how do they want to get home, and what does that look like for them? We really try to structure our care plans here based on our patients, and also provide them very detailed education on what that can look like, what your options are. Sometimes our patients do have terminal diagnoses and they came here to fight for an extended period of time, and maybe they've decided that they're not ready to transition to hospice, and we're going to keep fighting with them. At some point, they'll either recover or they'll decide that there is no more to give. And we want to be there with them so that we can even help in that. We need to provide people dignity in that moment and allow them to bring in their loved ones, include their culture, their religion, and engage in that as healthcare as a full holistic piece. Our ultimate drive here is to get our patients to fully recover, back to their level of independence. That makes everything worth it, because we have had a small hand in this patient's journey to fully recover when they were told that maybe they couldn't. It wasn't a committee that we actually had within the hospital until last year. We needed to have a stronger hand in community engagement and really start addressing those social determinants of health and health-related social needs. Case management and I have really worked strongly together, and some of clinical nursing, so that we're capturing data through assessments and surveys and then finding out what our population needs. Last year, we had a really big focus on mental health. We developed a suicide screening tool implementation, and then we worked with Mental Health Association Oklahoma to develop care need backpacks and work with one of the homeless shelters here to address different things. This year, our big focus is food insecurity. So we're working with Broken Arrow neighbors, band, doing food drives, participating in social gatherings, fundraising, and we attended the Defying Hunger Gala, where collectively we were able to raise over $150,000 to help fight food insecurities here just in our community. Our hospital, our team is actively working on addressing something and being present, and how we structure what we look at each year is based on those survey results within our hospital. Our food drive was for that same organization, and just locally within our hospital, again, small facility with about 80 employees, we were able to raise about $1,500 worth of food product in just a month. Our team has an amazing heart. It's far beyond just our patients in-house. It's for our whole community and each other. I think that that's a testament to the leadership team here. We lead with love, and that is what we want to be, what we're known for. I had mentioned Mental Health Association Oklahoma. They have a huge hand in our homeless community here in the Tulsa market, working with the Denver House and ensuring that those individuals in our community have resources that they need, whether that be the shelters, a bed to lay in. Last year, we provided over 80 backpacks. Each of those backpacks had clothing items, food, personal care items, so that they would have whatever they need in any circumstance. That was a summer project. We plan on repeating that again, but shifting more towards Q4 winter time. Working within the healthcare field, I'm predominantly working with women, and I have seen way too many of my friends and colleagues be diagnosed with breast cancer. It started out really small, just kind of being told about the Susan G. Komen Race for the Cure. From there, it's really grown. We're heading into our third year participating in the Tulsa Race for the Cure. Along with that comes financial sponsorships, raising money as a team, and supporting each other in racing. Last year, our CCO was diagnosed with breast cancer, and we were able to race for her and with her and her family, and that was an amazing opportunity. Just to see her fully be empowered and lifted up and know that she's not alone in that journey, along with some of our other peers. I'm now part of that leadership committee through Susan G. Komen. They have a program that they call HER, and it's Health Equity Revolution, and it looks at breaking down barriers for those that are marginalized, discriminated against, and just don't have the resources. Currently, they're only in a select few cities. My goal is to work with them and their area director to get that implemented here in Tulsa. It's just now kind of started the beginning of this year, working with Sherry Holman. She's the executive director for Oklahoma and Arkansas, trying to really grow and help people understand what health equity is. There is a difference between everyone's included and everyone's involved versus truly being equitable, so that those that are marginalized do receive the additional thought, care, and resources that are needed. Breast cancer does affect people of color significantly more, and that goes into also being marginalized and not having enough resources. We're one of the very few hospitals that are still paper charting. Our hope is that we can actually get integrated into an EHR in the coming years. The biggest problem and barrier that I think is that for small companies and organizations is that financial cost of being able to secure that multi-million-dollar contract and integrate that into your facilities. Currently at our level, we do utilize different radiology platforms. Last year, we implemented a new language service, and through that, we're now able to do a roll-around iPad essential service that allows our patients that don't have English as a primary or first language to communicate with somebody. They also have a platform for our people that are deaf and need to be able to utilize sign language to communicate. I really love that we are slowly integrating that in. Being somewhat small, we don't necessarily have all of the consult opportunities or providers that are here. So we utilize a telehealth platform where we have neurology, psychology, cardiology that can come in, that if they're not able to be here on site, that they can utilize that feature night, weekend, holiday, etc., to ensure that our patients always have that coverage. personally, it's that involvement with my patients and their family. Just having that rapport with them and knowing that I was able to help them recover or be there with them when they were really struggling or dealing with something challenging. You can't describe it. It's truly fulfilling, and it makes me want to continue to show up here every day and see my team, see my patients, the families, and just be a part of that. It really, really does just fill your cup and make you love what you do. In current climate, there's been just overall kind of a disrespect towards nursing, and it's those moments when you have those patients that can tell you thank you and have that intimate moment to express their gratitude for that care. My biggest advice is don't allow yourself to be consumed with the negativity of the world. It has a way to just suck you in and not spit you out, and you just get stuck in it. Don't allow that. We became nurses to help people. When you're in a negative mindset, you're not going to get very far in that patient recovery. Our integration of technology and integration of health equity and community involvement is what we needed. The care doesn't stop when the patient discharges. That's just looking at a diagnosis. We really need to look into our communities and see what's contributing to those diagnoses. How can we stop that as a whole versus just one or two patients? I just want to see a lot more growth within that for our hospital community and surrounding hospitals that we work with. Nurses work really long, hard hours, and they have to pour so much of themselves into their patients. So whether that is just a patient saying we can do or a loved one that's able to echo that same sentiment, it means the world. It validates what we're doing. Same for the leadership team. It's vital for us to uplift our teammates and let them know when they're doing good, and at the same time provide the constructive feedback that they may need when something's not going right so that they can improve. That feedback is what's going to continue to keep us going in the right direction, keep perspective on why we became nurses and why we do what we do. Sometimes I think we just lose sight of that. We get too interested within the hours within the day, what needs to be done, what didn't go right. And again, the financial dollar can contribute to that stress too, and absence to give praise when it's due. As far as our hospital, I just want us to continue to grow. People that know that we care for our patients outside and inside of this hospital. There's a whole lot more to come from us. We're just getting started.